SSRIs, or selective serotonin reuptake inhibitors, are a class of medications that are used to treat depression and anxiety. These drugs work by increasing serotonin signaling at neurons in the brain. In this mnemonic video, I'll share my visual way to remember the SSRIs, their mechanism of action, clinical indications, and side effects. I've been training as a sushi chef in Japan for years, and I've finally been granted the chance to make the sushi for the customers. Yep, focus on how I'm spreading the rice with my hands. You know what? Sushi rice kind of reminds me of SSRIs, right? Because SSRI stands for sushi rice, right? I'm kidding, of course. SSRI actually stands for selective serotonin reuptake inhibitors, but I like using sushi rice to memorize the acronym SSRI. Now that we've anchored ourselves to this scene on SSRIs, let's cover the exact medication names you should know for test day. As a sushi chef, we get the world's best seafood, and today, I'm preparing some really interesting stuff. I bet you've never seen parrotfish served up at a sushi bar. That parrotfish actually looks remarkably like a parrot, don't you think? Anyways, this parrotfish will be our symbol for paroxetine, the first SSRI to know. Got that? Just think parrot, satine. It's the paroxetine parrotfish. As an accomplished sushi chef, I always like to keep my ingredients handy. Just take a look at that bag of flour I've got in front of me. Must be for the dumplings or something. Anyways, this flour reminds me of fluoxetine, our next SSRI, because flour sounds a bit like fluoxetine. I think the manufacturers of this flour have even moved the spelling of flour around here to help you remember fluor or fluoxetine. Got that? Great. A couple more drugs to go here. If you've ever seen Jiro Dreams of Sushi, you would know that the best sushi places are always found in the most unassuming locations, like under escalators and train stations. You know what? That escalator there is a great symbol for escitalopram, our next SSRI. Escalator, escitalopram. Pretty similar there, right? Let's take the escalator pram down to the sushi bar. Nice. And like a deal at your favorite sushi restaurant, I'm going to give you 2 for the price of 1 here. If you can remember the escitalopram escalator, just drop the ES for citalopram, another SSRI drug to remember. Got that? Escitalopram and citalopram. Perfect. Okay, last one here. Take a look over at my busy server on the right. We will get to those to-go bags and why he's looking so anxious in a moment. But for now, remember that server will be our symbol for sertraline, our last SSRI. Got that? Because server sounds a bit like sertraline, right? Like serve-traline. Our sertraline server here is burdened with to-go bags, which we will turn to now to learn the mechanisms of SSRIs. Alright, we've covered all the names of the drugs you need to know, so we can finally move on to how the SSRIs actually work. The sushi I make here is so good that customers always want to take food home. And like any Asian food establishment, my sushi shop has takeout bags with that happy face printed on them. Coincidentally, this happy face is our recurring symbol for serotonin. You know, a happy face for serotonin, since serotonin is the feel-good neurotransmitter, right? This is all to help you remember that SSRIs increase the level of serotonin in the brain. SSRIs do this by blocking transporters that take serotonin out of the synapse and back into the neuron that released it, which are formally called reuptake transporters. So, by blocking serotonin reuptake, you can reason that SSRIs thereby cause an increase in serotonin levels inside the synapse, which in turn leads to increased serotonin signaling. An increase in serotonin signaling is thought to be the basis for mood improvements that we see with SSRI use. Make sense? An increase in the feel-good neurotransmitter serotonin with SSRI use should lead to more happy faces, right? Now that we've got the mechanism out of the way, let's talk about how we use the SSRIs in the clinical setting. Yikes! It looks like some of my patrons have gotten into a relationship fight over the meal. Yep, just check out that crying couple sitting at the sushi bar. Looks like they have gotten into a pretty heated argument and might be breaking up. This crying, sad couple actually reminds me that SSRIs are also a treatment for depression. You know, because this couple must be pretty sad and depressed to be crying in public at a sushi bar. SSRIs are the first-line treatment for major depressive disorder, used in combination with cognitive behavioral therapy, or CBT. We've already covered how this works. The drugs improve mood by increasing serotonin signaling in the brain. Just remember the depressed, crying couple here to clue you in that SSRIs are often used to treat depression. Oh man, my server really looks on edge. Just look at how anxious his face is. I mean, I'd be pretty anxious too if I was serving some customers who were crying. Was my service really that bad? The anxious face on the server here reminds me that SSRIs are also used to treat disorders of anxiety. Got that? SSRIs are the first-line treatment for a number of anxiety disorders, including general anxiety disorder, panic disorder, post-traumatic stress disorder, obsessive-compulsive disorder, and social anxiety disorder. It's pretty safe to assume that if anxiety is a component in a particular psychiatric disorder, SSRIs are used to treat that disease. Similar to depression, SSRIs are often used in combination with CBT, or cognitive behavioral therapy. Got that? For now, remember that our server here might benefit from a serious dose of SSRIs with his seriously anxious face. Alright, before we finish with the clinical uses, I just want to take a quick moment here to remind you that it can take some time for SSRIs to take effect. In fact, SSRIs can take 4 to 8 weeks to improve the anxiety or depression symptoms of your patients. This is more of a step 2 or psychiatry shelf fact to know. But I just thought I'd touch on this for good measure. So don't give up on your patient who is not feeling better right after starting an SSRI. You gotta wait a month and then see how they feel. Still with me? Great. Time to move on to some of the side effects associated with SSRI use. Oh boy. I'm looking back at this couple now and I'm sort of learning that this breakup might be one-sided. See the way that woman on the right is putting her hand up, rejecting the kiss of her confused lover? This rejected advance should remind you of sexual dysfunction, a common side effect associated with SSRIs. It's not entirely clear how SSRIs cause this, but you should remember that patients taking this drug very often have low libido or sex drive and may have difficulty achieving orgasm, referred to as anorgasmia. Sexual side effects are actually very common and a common complaint of patients taking these drugs, so you need to remember this for test day. Okay, one more big side effect to go, and this one should be pretty straightforward. Our server over there seems to be having trouble handling all those to-go bags with the happy faces on them. He's being overloaded with happy face to-go bags. Actually, being overloaded with happy face to-go bags really reminds me of serotonin syndrome, another high-yield side effect associated with SSRIs. Pretty easy thought process here. Since SSRIs increase serotonin, it makes sense to associate them with serotonin syndrome, which is basically a disorder of too much serotonin signaling. This can happen with high doses of SSRIs, but it is more typically seen when a patient on SSRIs is prescribed another medication that also increases serotonin signaling, such as a tricyclic antidepressant or monoamine oxidase inhibitor. Make sense? Clinically, serotonin syndrome presents in its patients as agitated, with altered mental status and unstable vitals, which can include high temperatures, elevated heart rate, and labile blood pressures. These patients also show evidence of neuronal hyperactivity, such as seizures or exaggerated muscle tone, and it is very high yield to know that these patients often have overactive reflexes and clonus, which is a rhythmic, involuntary muscle contraction. Clonus is usually tested by reflexing the foot quickly towards the shin. If a patient has clonus, the patient's foot will continue beating up and down as their muscles rhythmically contract. Anyway, why is this so high yield? Well, symptoms such as overactive reflexes and clonus help to differentiate serotonin syndrome from neuroleptic malignant syndrome, or NMS, a different disorder seen with other psychiatric drugs that can also present an altered mental status, unstable vitals, and hypertonia. The major point of contrast is therefore overactive reflexes and clonus, which are found in serotonin syndrome but not typically seen in NMS. Remember that serotonin syndrome is a medical emergency that is treated with cyproheptadine, which blocks serotonin receptors to dampen these symptoms. Pretty easy to reason through that one. Okay, a lot of information here, but long story short, SSRIs can cause too much serotonin signaling, which manifests as serotonin syndrome. Serotonin syndrome and sexual dysfunction are the high-yield, testable side effects for SSRIs, but it is possible you may encounter some other low-yield side effects. SSRIs can cause GI distress, such as diarrhea, nausea, or vomiting, especially when first starting an SSRI. They often reduce the duration of REM sleep and increase the time it takes to enter REM sleep, known as sleep latency. Lastly, SSRIs rarely can cause SIADH, or syndrome of inappropriate antidiuretic hormone, which results in electrolyte imbalances due to the body holding on to extra free water under the influence of overproducing ADH. Finally, it's worth noting that when an SSRI is discontinued suddenly, patients can suffer from flu-like symptoms. This is why SSRIs are typically stopped with a slow taper instead of a sudden stop. All of these side effects are not really testable, so you shouldn't really spend a ton of time here. As I like to say, high scorers don't score better by trying to cram every little fact. They do better by focusing on the facts that really matter. And for SSRIs, those side effects are sexual dysfunction and serotonin syndrome. Got that? Okay, that's it for SSRIs. These are also one of the most important drugs in psychiatry, so let's recap. Selective serotonin reuptake inhibitors, or SSRIs, are drugs used for a variety of psychiatric disorders. Important SSRIs to know include the drugs paroxetine, fluoxetine, escitalopram, citalopram, and sertraline. These drugs work to increase serotonin signaling in the brain by blocking the reuptake or transport of serotonin out of the synapse. SSRIs are the first line of preferred treatment for patients with depression and anxiety disorders. The most important side effect of SSRIs include sexual dysfunction and serotonin syndrome. All right, I'm going to go serve up some more sashimi and keep watching that cringy public breakup. See you on the next one.